Hi, good afternoon.
Good afternoon.
Hi, how are you?
Good. Just wanted to make sure that you can hear me okay.
Yep, no, we definitely heard you, and we'll be getting started shortly. Just allowing some folks to come on in, and then we'll get started.
Perfect, thank you.
Welcome once again to everyone. We will get started shortly. Just allowing some folks to come on in. It's still 12:57, so thank you all for being early. Thermo Fisher, we're looking forward to what you all are going to share. Okay, well, good afternoon to everyone. It is 1 o'clock, and so we want to be mindful and respectful of everyone's time. I know folks will trickle in as we continue, but good afternoon. My name is Damon Hoyle. I am the Senior Operations Project Manager here at Texas Education Agency, and I'll be joined today by my colleagues from the Texas Department of State Health Services, DSHS. They'll be joining shortly. That is who TEA collaborates with in terms of this Reopening Schools grant, which is the $800 million grant that Texas received in order to provide COVID testing products or services to public and private schools through the vendors. And so we want to thank Thermo Fisher for joining us today. Before I turn over the mic to Thermo Fisher, wanted to go over a couple of quick things. At the end of this session, we will have a Q&A segment. So after the presentation, we'll have a Q&A segment. So please feel free to all the attendees in the Q&A feature at the bottom of your screen. Feel free to put in your questions as the presentation goes on. You can also use the chat feature. So that will be at the end. Also remember that this session is your time to ask questions, is your time to learn about Thermo Fisher if you're not familiar, and if you are familiar, to learn about how things might be tweaked or changed as we go into the 2022-2023 school year. So please feel free to engage. That's how we get the most out of these. With that said, I will turn it over to Karen, to Thermo Fisher, and welcome you all. There you go. And then Karen, if you want to come off of mute.
Great, thank you so much. And thank you for having us here today to present out a little bit more about the ReadyCheckGo program. I am just going to take us into full slide view. Here we go. And talk to you a little bit today about some of the testing program options as we start to think about the 2022 and 23 school year. We're going to be talking a little bit about Thermo Fisher and Keller Health and the strength of the partnership and what we can bring to school testing as partners for all of you. Talk a little bit about the highlights and updates from the ReadyCheckGo program. Some of you may be familiar with the program, maybe have used it in the past school year. So talk a little bit about some of the successes that we've had in the state of Texas. And then how do we go ahead and get you started? So as a quick introduction, my name is Karen Cormier. I'm Global Marketing Manager with Thermo Fisher Scientific. I am running the ReadyCheckGo program across the US, and I'm joined today by Eve Sutton from Keller. Well, I'll give her a moment to introduce herself.
Hi, everybody. My name is Eve Sutton. I'm here representing Keller Health. I'm a partner manager here, and we are the software portion of the ReadyCheckGo program. So looking forward to diving a little bit deeper into this program and what that means for you all. And I'll kick it back over to Karen. Thanks.
Thanks. So let's talk a little bit about school testing as a whole across the US. So when the pandemic hit, Thermo Fisher reacted very quickly. We have not only been involved in testing through schools, but also designed and developed PCR testing that's being used in over 50% of all of the testing labs across the world. We responded very quickly and really jumped in to ensure that we can start testing and understanding COVID even more as we progress through the pandemic. So being able to bring this into schools is extremely important to us. Maximizing in-person learning days, as we know, is one of the most important things for our children at this point. They need to be in school. They need to be able to learn with their peers and also with their teachers and their staff. And our goal is really to keep them healthy and safe so that we can maximize the number of days that they're able to be in the classroom. And with that, we've actually conducted through the ReadyCheckGo program, over 1.5 million people have been tested through our program in the current school year. That spanned across over 1,200 schools throughout the United States. And really the power of our program is being able to deliver one single source. So really simplifying the process for schools to be able to sign on, sign up, and receive the testing that they need, both from the supply perspective, but then also from the results perspective as well. So really single source turnkey solution that's enabled these schools to really quickly access testing and be able to implement programs. As you can see, some of the successes we've had across the US. Once again, this would would not be possible without the partnership that we've put together between ourselves, Thermo Fisher Scientific, from the testing, from the partnerships that we have with the labs across the US, and our partners with Color. So I'll turn it over to Eve for just a moment to talk about the part of the partnership that Color is bringing to the ReadyCheckGo program.
Thanks, Karen. Hi, everybody again. So Color Health is a health technology company, and we've been helping schools across the country perform COVID testing and vaccinations since really April 2020. We're all about making the kind of complexities of COVID testing simple here. And that's really the goal of the ReadyCheckGo program. So we provide the software for patients to register and to receive results, and for staff to collect samples and track results. This strong partnership is really an end-to-end solution, and we're excited to show you how easy it is to have testing in your school.
Excellent, thanks, Eve. So let's start by taking a look back. Let's take a look at the 21-22 school year and some of the key highlights that have happened in the state of Texas. So Thermo Fisher has been very fortunate to work with over 70 school districts across the US to provide varying types of testing in schools, both large and small districts across the entire state. We've been able to partner with 2 different labs for those that were taking part in lab-based testing. So we use 2 labs, one of which is local to the state of Texas. And we've been able to offer different types of testing, depending on what the needs are for the individual school or district, inclusive of both rapid PCR options PCR options and also rapid antigen options as well. And with that, we've been able to make some significant discoveries in the data. So if we take a look at some of the positivity rates that we're seeing right now, they're quite high. So these are the positivity rates that we've seen actually from the samples that we're collecting from the schools throughout the state of Texas. So well over 20% at this point. And we're seeing slightly varying positivity rates between the antigen and PCR testing, just depending on how that testing is being accessed in the schools. So anywhere from 20% up to 31% positivity rate. So with our goal of being able to identify those individuals that are within the school community that are positive, and being able to test them and be able to remove them from the school population before they're able to infect others. We really see that testing is an effective way of being able to identify those who may be positive in that population and get them removed quickly, so that we can curtail the spread within the school or within the district itself. We took a look back at our time to results as well for those that were conducting PCR testing. We had, as I mentioned, multiple vendors, and the average time to return a result from the time that it was sent to the lab is about 20 hours. So we're really pushing down the amount of time that it takes to be able to get a highly accurate PCR result, and being able to inform schools in a timely way so that they can make decisions on a day-to-day basis and adequately prepare for the upcoming school day for both their students and their staff. So with that, we want to talk a little bit about programs as a whole, and some of the considerations that schools have gone through and will need to go through if they've implemented or are planning to implement a testing program in their school. Really, the goal is to let you focus on education. Let teachers go in and teach. Let our educators focus on ensuring that students are receiving the highest level of education as possible. This is inclusive of ensuring a healthy learning environment. So you should start to take a look at programs that are able to provide the healthy learning environment, enabling testing and being able to, once again, identify those that may be positive with minimal disruption to the day. So really allowing our educators to focus on education. And really, we want to be able to keep as many kids in school as possible, maximizing those in-person learning days. So minimizing the time that a student or a staff member would need to quarantine, and maximizing the time that they can spend in the classroom and in the school. So with that, it seems like a big process. It seems like a lot to be able to bring on a testing program. But really, with the ReadyCheckGo program, we've highly simplified the process to be able to implement a program and actually administrate the program as well. So as Eve mentioned, we have a software platform that is the backbone of the ReadyCheckGo program that really allows for the simplification of the sign-on, the sign-up, and being able to administer the program from a dashboarding and reporting perspective. This really decreases the amount of time needed on the part of the school to be able to administer the program and really allowing them to, once again, focus on the classroom. We also use primarily PCR as the testing methodology. We know this is high sensitivity. It's a very proactive approach to being able to test, which enables schools to be able to test students and staff on a weekly basis and be able to detect those that may have been infected already, but not necessarily showing symptoms yet, and identifying them early so that they can be, once again, sent home and being able to go ahead and recover rather than staying in the classroom where there is the opportunity to be able to spread infection to others. So if we take a look at the sampling process itself, it's very quick and easy. I think we've all been exposed to the swabs that you have to go all the way up to your brain to take a sample, and these are certainly not that. We use a very short swab that's used in the very front part of the nose. It's simple and easy enough for a child to be able to swab themselves. And it's really fast. So kids can come in, they can swab, they can, hand their samples over, and they're ready to go. So I'd like to show you a very quick video of the sampling process. This is just an example of how kids can enter a classroom, do their swabbing, and move on with their instruction for the day. There is a little bit of music that goes with it. So if the music's not playing, there are some subtitles. Great. So you can see it's very simple for the kids to come in. Oh, we don't need to watch it twice. Very simple for the kids to come in, grab the swab that they need, or be called up to the front and be handed their swab, do that self-swabbing themselves, and either put it into the tube or hand it to the administrator, depending on what testing type they're using. And mentioning testing types, as we're probably all aware at this point, there are multiple testing types that are available. With ReadyCheckGo, we offer a variety of testing types that are available that span between the PCR tests, which are the swabs that get put into a tube and sent out to a lab, along with more on-site type testing like antigen testing, which allows you to be able to administer the testing and actually conduct the testing on site as well. We really wanted to include this slide as more of a piece of education for all of you, so that as you're starting to think through your plans going into the next school year and what type of testing you might want to bring on, this is a great educational guide as to what each of these testing types are, what they're actually testing for, a little bit around how long it takes to conduct that testing, and some of the details of what you can expect from the results of that testing. So I'll leave this with you to take a look at, but just as a point to show that there are multiple types of testing. ReadyCheckGo encompasses both of these. So you have the freedom to choose what type is best for you, for your school, and for the type of work, if you want to do the testing on site or if you want to send the testing out. So let's talk a little bit about the program. So I mentioned there's multiple testing types. This is an overview of the different types of testing that are available in the ReadyCheckGo program. You can see at the top, we have multiple types of PCR that are available, inclusive of lab-based pooling and individual testing, both of which give an individual result, but are conducted in a slightly different way. With lab-based pooling, each individual will come and do a swab and put their swab into a tube. Those tubes are sent out to the lab, and in the lab, they'll go ahead and choose 5 of those samples and pool them together and test them as an individual sample. If that pool of samples comes up negative, everybody in the pool is negative. If there happens to be a positive, the labs will have retained those individual samples, meaning that they can go back into them and test the individual samples on their own and determine which of the individuals was positive when they contributed to that pool. Similarly, we have individual testing, which, per its name, it would be one sample, one person that's all tested individually. But then we also offer on-site testing options such as rapid antigen testing. These are the rapid tests that we're all very familiar with these days, which allows for individuals to be able to test quickly. The testing is conducted on site, so no need to send out to a lab. And all of these are included as options in testing types in the ReadyCheckGo program. So just an example of, what does it look like when it comes to you? So if you're taking a look at some of our PCR lab-based options, everything comes to you together in a big kit. So you have your box on the left, which is sort of the shipping box that you receive with all the contents inside. Inside, you'll find prepackaged materials, enough for one for each individual. This is inclusive of swabs, barcoded tubes, and all of the other materials that are needed to be able to package that sample to be sent to the lab. We also have pre-labeled mailing boxes to be able to package all those samples up that you collect in a day and send them out to the lab. So very turnkey, very simple, sort of ready to go, ready to use once it's received on site. And for antigen testing, if you decide to move in that direction, antigen testing, we offer 2 different types of testing. We have BD Veritor and then the Quidel QuickView kits. With the BD Veritor, there is, as you can see, a small instrument or device that comes along with it, where you will be doing the antigen testing, and it will help you to read those tests so that it does take out a little bit of the ambiguity of, is there a line, is there not a line? And with the QuickView tests, those are more of your traditional antigen testing that we're all really used to using these days. So a little bit more educational information about lab pool testing. This may be a new concept for a number of you. As I mentioned, this is where individual samples are pooled together as a sample in the lab and then analyzed. This is typically done with 5 samples that are pooled together and tested together. And once again, if any of those pools were to come up positive, then they would go back to the individual samples that were submitted and retest each of those individual samples that contributed to the pool. This really allows for individualized reporting on the back end, enabling you to be able to really determine who is it, that singular person or the people that had contributed that truly are positive, to be able to make sure that they're able to stay at home and out of the school population, while allowing those that did not come up positive within that pool to remain on site and continue to stay in the classroom or in the school. Results can be
Did she freeze a little bit there?
It looks like it.
Okay.
Yeah, I think we might have lost her.
Eve, did you want to take it from there until she jumps back on?
Yeah, I'm happy to go ahead and take it unless anybody from the Thermo Fisher team wants to jump on. But I think that what Karen was just about to say is that results should be available within 24 to 48 hours for the lab pool testing. And The one consideration to call out is that when the positivity rate is high, pooling strategy will require more samples to be retested, so the turnaround time might not be quite as good. Let me see if I can pull up the deck really quickly.
No worries. And I know we already have some questions, a question that's in there, but we'll give you some time to pull up that deck. While they're getting set back up, if anyone has more questions, please go ahead and put those in the Q&A feature, because we're going to continue to, at the end of this, as I mentioned before, we're going to have a Q&A session. So please continue to put your questions in there while we allow Thermo Fisher to get set back up with the slide deck.
Thanks, and thanks everybody for your patience. I do see one question on pooled testing. Is each individual sample labeled with a patient identifier? So for all of the PCR tests, they're going to have a barcode on the side of the tube, and that barcode is how we'll know who that sample belongs to. So in the case of a pooled sample, every test is going into an individually barcoded tube, and then the lab keeps track of which barcodes were in that sample so that they know how to retest.
Thank you for that. And then there's a question in the chat. It says, if we continue with the antigen testing this coming year, will we be using the BD Veritor?
Yes, hi, this is ReadyCheckGo with Thermo Fisher. And the answer is, if you've been using BD Veritor, you can continue using BD Veritor. We will also be offering the Quidel QuickView, which is an over-the-counter, the very similar one that does not require an analyzer.
Got it. Thank you. Then they're asking, someone just asked, what if testing units expire?
Those expiration dates are set by the manufacturer and are, when possible, we check with the manufacturer for any extensions that they are allowed or authorized to do. But we are going to be monitoring, and it will be much easier for us to keep track of the expiration dates as people are ordering. So the expiration dates will always be sent out with the longest possible that we have access to. And, you know, if you have any questions, please direct those questions to us and we will be happy to look into that for you.
Got it. Thank you. There's another question now in the Q&A. How is staffing going to work for the 2022-2023 school year, since we would like to keep the COVID-19 staffers for the new school year?
At this time, for the 2022-2023 school year, Thermo Fisher is not offering staffing. So that would have to be something that you'd be directed through dishes, through the Department of Health. And our offering is now for the testing.
And so another question, I think you already answered it, this is in the chat. So the staffing decision, they were asking, is it pretty set? Is it written in stone? Is that the final decision? Would there be any room for that to change, or is that we're moving forward, Thermo Fisher is moving forward without offering staffing?
It is my understanding, and I'll defer to any of my other colleagues, but that our final decision was to not offer staffing at this time.
Okay, and I see Karen is back. How you doing, Karen?
I'm good. I apologize. I am in a hotel and they turned off the internet.
Okay, we had a little early Q&A session.
Perfect.
Yep, no worries, no worries. So, and then the last question, and then Karen, I think you had, I don't know that you were quite done with your PowerPoint. Let's get this question in and then we'll jump back into the PowerPoint. And it's okay, kind of broke it up a little bit. We're good to go, we're flowing. So question says, so what happens to the staff that were at the campus, I guess this year is what they're asking. So meaning if they're currently using staffing, they're just saying what happens? Would they, after this month, after June 30th, they would cease, or
they would cease? That is correct. The contract completes at the end of next week, I believe it is. I'll have to double check on that date. But that once that staffing is over and the first round of this contract is completed, we will no longer be working on securing that staffing and managing that staffing.
And this is Diane from DSHS. And we actually, for Thermo Fisher's knowledge, we actually published the date as an effective date of 8/1 because there's no vendor staffing that's going out in July. And I know that your documents that you submitted said July the 1st, but we just did it for August 1st since nothing's happening with staffing anyway in July. So schools that are interested in staffing there's a couple of different things that can happen. And I am going to put emails in the chat so that you can email me or email COVID case report.
Okay, and Karen, you are now a co-host, so if you want to share your screen again, you can.
Great, thank you so much. And I truly apologize. I am actually attending the National PTA Conference this week, and there were a little bit of connectivity issues. So I apologize, but it was great that we were able to get some questions in between. And, you know, let's definitely keep this interactive. So if there are any more questions that come up, you know, happy to take those at the end, or if we need to pause, we can most certainly do that as well. So appreciate the accommodation. So just hopping right back in, just wanted to be able to show some additional testing types along with some of the details around that, really just to be able to use as some educational material post-presentation for you to understand what the different testing types are, how they work, and then some of the benefits and considerations of each of the different types of testing. So we've talked a little bit about pool testing, we talked a little bit about individual PCR testing, and antigen testing as well as an option within the ReadyCheckGo program. You know, so for those of you who have already been doing antigen testing or that require very quick turnaround time on results, antigen is going to remain an option within ReadyCheckGo going into the next school year. So let's talk about how to get started. So Eve, if you would like to.
Yep, absolutely. So in terms of getting started, we make it really easy to get started and manage this program on an ongoing basis. We do understand that the people who are managing this program are probably wearing 15 to 20 other hats and have a lot of things going on. And I know there were some call outs about staffing. So the goal here is really to make sure that this program is sustainable for you and your school to be able to run. So in terms of kind of getting up and running, we'll take care of all of the participant registration, and that flows seamlessly into the sample collection tool that you will use to tie people to their results or to report results in the case of antigen testing. For support and training, we'll provide support to your team 24/7 via phone and email, the same for participants. In addition to live training, so we'll host webinars and office hours similar to this, where we will run through training decks on a regular basis, and then also be able to answer questions on an ongoing basis if you have questions about how to use our dashboard or how to use a particular test. And we'll make sure that families have really the same support. Lastly, and again, back to that piece about having your staff this program, we want to make sure that it's really a light touch program that's a little lift for your team to set up. And we make that process pretty easy. So if we want to go to the next slide, we'll walk through what that process looks like. So from start to finish, from the time that you sign up to when you get started testing, should be less than 5 days. You will complete an onboarding form, which is just a simple online form, and then go ahead and receive your supplies in really the next day. Everybody who needs access to either help perform testing or to view results will get assigned that access automatically. And you'll also have the ability to actually assign more people that access. Let's say that roles change. I know everything's very dynamic right now. So if roles change, you can easily pass that role that you have on to somebody else. And then registration will begin. So we have a custom webpage for the Texas program where you can go and search your school and find the appropriate registration links for both staff and students, which means that if you're sending out a big communication to staff and students about this, and students' families about this testing program, you can just send them one link and they can go ahead and find the right place to sign up. Makes it really easy for families that have multiple kids in one district, they can go through that page and find all of the different schools that their kids might be at and sign them up for testing. We also have a number of resources like email templates that you can send out to families, and flyers that you can send out so that they can easily have access to those registration links. So once participants have registered and consented, and that process is all done digitally, it's available in 2 languages, Spanish and English, and really just takes them 5 minutes, and it's a one-time registration, you can begin testing. So let's say that you are doing PCR testing, you'll set up the materials, individuals will come and swab, you'll tie them to their tests, and then FedEx will come and pick up the samples. And then in under 24 hours, you should, or 24 to 48 hours, you should see results coming into your dashboard, and we'll manage all of the follow-up resulting information to the patient. So they'll get a text and an email, which I will talk about in a second here. Lastly, if you're joining, it sounds like we have some people who have already participated in this program, so that they loved the color platforms. That's great to hear. There's no onboarding required. We just have to get you get you your new shipping materials, but you don't have to really do that first step of the process. Great. So in terms of what that sign up process looks like, we're going to have a link and an email at the end as to where you can email if you do want to sign up for the program. But after you've signed up and ordered supplies, you'll have access to all of that training. In addition to that, you'll have access to posters for how to set up your space, and also sort of hands-on materials that people who are helping with testing can utilize. And if you want to go to the next slide. This is an example of what the registration process looks like for participants. It's available again in both Spanish and English, and it's a one-time registration. So somebody just needs to register and consent once, and then they're good through the school year for participating in the program, which means that you don't need to manage if a student is presenting with symptoms or they need to get tested. You don't need to call the parent or anything so long as they've already been registered in the program. If you want to go to the next slide. Resulting is super easy for the participant. Their parent or the participant, if they're over 18, will receive a text and an email once their results are ready. In the case of PCR, let's say that that's 24 to 48 hours after they collect their result. In the case of antigen, it might be more like 45 minutes. So they'll get that text message, they'll click the link, and they'll be taken to a HIPAA secure web page. They don't need to create an account or anything. So if you have family members, families at your school or your district who don't have access to an email, they can just get it through a simple text message. And then they can receive their results in the same language that they registered in. So if they registered in Spanish, they'll also receive their results in Spanish. If you want to go to the next slide. Really, one of the key pillars of this program is the support that we provide. We provide support via phone, email, and those webinars that I mentioned, both for parents, families, teachers, and the staff who are helping with testing. We have a concierge service that'll help you get set up through onboarding. We have comprehensive training materials so that if things do shift in your team, we can set up an additional webinar, or you can direct them to videos that they can watch that are recorded on how to do the testing process. And we are really here just to support you through this process, especially given that your team will be taking up any staffing needs, which might be different. But just to call out that we have rolled out similar programs at churches, libraries, and across, I think, 6,000 schools across the US. And we've really been able to make it work with even just one staff member. So thanks for letting me walk you through that. And I will kick it back over to Karen, who's going to share some thoughts and quotes, I think, from some other programs we've done.
Great. Thanks so much, Eve. So just wanted to close out our presentation today with a little bit of what others have said, and really, the experiences of some of those that have been participating in the ReadyCheckGo program. So we've really been collecting some of the feedback from those that have been participating through the last school year. And you can see that there's been some really positive response, especially around the area of support and customer service, and really being able to help schools quickly implement and get up and running, and then also continue to keep the program, running smoothly, always sort of having somebody there to help you. And the implementation didn't take very long, about 10 to 14 days for this particular school, where it really started from conversation to implementation. So very quick and easy to get started. And the schools themselves find it very empowering for their students and their staff to be able to understand and have the ability to be able to test, and that added level of comfort of knowing that people are going to be coming to school healthy, the classrooms are going to remain healthy and safe, but really have, once again, that sort of freedom of choice to be able to participate or not, and really enabling those that want to participate to quickly and easily get started. So if you're ready to get started, there's a couple of links for you to be able to start your outreach. So at the top next to exclamation mark, if you're ready to get started or you're interested in learning a little bit more about the ReadyCheckGo program that was presented to you today, or the different testing types that are available to you, this is a Texas specific email inbox that will go directly to those that are working in the state of Texas, and they will get a hold of you within about 24 hours of you submitting your request, your email, or your question. We've also included the link to the TEA website. And if you have questions as a whole about testing in the state of Texas, they are a great resource for you to be able to reach out to as well. And just closing out our presentation today, as I mentioned, I'm at the National PTA Conference this week, and that is because Thermo Fisher has actually partnered directly with the National PTA to work together to maximize in-person learning days. So really being able to support the mission of the National PTA to be able to ensure that we can keep our schools healthy and safe, and ensure that we can really maximize all the time that students spend in school, so they're not sitting at home in quarantine or having to get sick at school and miss a number of days. So we're very proud to announce our partnership, and you may be hearing a lot more about it after this week. So thank you. Really appreciate your time today, and happy to take any more questions that you may have.
Great, thank you, Karen. So I'm gonna start in the chat and then we'll move over to the Q&A feature. I'm not sure if Ms. Hubler, I know she has her hand raised, so I'm just gonna allow her to come off of mute and talk, and I know she put something in the chat, so maybe it's one of the same. So Ms. Hubler, you can go ahead and ask your question. Let me see. Is she still there? Well, in the chat, her question says, if we participated with Thermo Fisher Scientific last year, is there any registration or sign up for the coming year? So they wanted that clarification. If they're currently with Thermo Fisher, do they need to re-sign up with you all again, take the training again? They just need some clarification there.
Is the question about the color platform? There is a they do have to the participant would have to allow us to do that consent. In terms of signing up through us again, if they're already there, they can continue the program. So it would just need some clarification on whether that request is for the participant to go ahead and consent, and that would need to be, is that correct, Eve?
Yeah, so we're managing all of the any reconsenting that needs to happen, and some of it actually already began last year, so shouldn't be a concern. In terms of, I think the question might be, the participant. So they will just click sort of refreshing of consent and attest to that. And we actually started sending those out kind of casually towards the end of this past school year in April and May. So for the most part, most people have actually already refreshed their consent.
Perfect. Okay. Well, thank
So
you.
Damon, I'm sorry. So I think Carmela might also be asking about schools that are already participating with Thermo Fisher. Will their staff have to undergo some additional training or something for this year? Or is it's just going forth and you learned last year, so you're going to know it again this year?
Yeah, yes, there's going to be some online, we will have online refreshers if they need that. If they need something more substantial, if they have new people, we of course will take them through any training that they require.
Right. Okay.
Got it. All right.
So,
go ahead, Diane.
Oh, I was just going to say, so if the school is already signed up for color, then they'll be signed up again next year. Okay.
Got it. The next question, I'm going to jump over to the Q&A so all the panelists you all can see, and I think all the participants can see also. For TA and dishes, staffing is a huge need. What other vendors offer staffing? Diane, did you want to take that one?
Certainly. So for this program, we do have a total of 6 vendors that are participating. And Damon will be, or TEA will be posting a vendor resource chart of which lists all 6 of the vendors and what their offerings are and what they charge for each of those different offerings, like how much they charge for a rapid antigen test, how much they charge for PCR tests, and how much they charge for staffing. So that will be posted and Damon will talk about that or tell you where it's going to be located.
And since we're on the question, I'll just jump in now. I'm going to share my screen real quick so that folks can see where that is. Let me share it. So, can everyone see my screen? It should be
yes.
The TA website. Great. So this is the TA K-12 COVID-19 testing website. Right here is all that you need to know, all the links and different things that pertain to the COVID-19 testing program. In terms of the vendor resource sheet, we have the current one that's listed. It's right there. Let me make my screen a little bit bigger. The 21-22, and then we've already listed the 22-23 vendor resource sheet. As it is updated, because I know vendors change throughout the year in terms of their offerings, we'll update it and it'll be here. And this was updated June 13th, so you can see the date that is there. This is also where you'll find the Q&A, not Q&A, I'm sorry, FAQs. And then once this is over with and we post this recorded webinar and the presentation, it'll all be here listed under webinars and presentations with the title and the date that it was posted. So this is where you can go, and I'm going to highlight this link and I'm going to drop that in the chat. So I'm going to stop my sharing, and the link that you all see now in the chat is a link to what I just showed you all. So thank you for that, Diane. I'm going to go to the next question. For clarification, if we have units that are set to expire this month, can they still be used? If there's an extension, will you let us know? How do we expose of them or dispose of them rather?
So I can go ahead and take this. So as far as units that are expiring this month, depending on the date format of the expiration on the kit, it is usually the last day of the month that you would look at the outer box. And if there is a date, then that's the last date of use. As far as disposing of the kits once they have expired, we do have a flyer or a kit disposal guidance, but it is also recommended that you refer to the TEA website for additional clarifications if there's any specifics that TEA requires of the districts and schools.
All right, thank you. Next question. This is for you, Diane, specifically. It says, Diane, can you re-inform us of what the August 1st, 2022 date means for staffing?
Certainly. So all of the vendors made changes for the 22-23 school year. And one of those changes that were made by Thermo Fisher is that they'll no longer offer staff. So that's their effective date. And August 1st is just the date of what we chose for the 22-23 school year.
Got it. Thank you. And you all, the next question kind of is a repeat of, if you will, or it's on the same topic as earlier around staffing. And so just to reiterate, Thermo Fisher, correct me if I'm wrong, After June 30th of this month, well, that is this month, after June 30th, staffing for Thermo Fisher will no longer be offered next year. And so the person is just saying, because they've used staffing to really set up and be the crux or the basis of which they have their testing program, they just want to know would it be reconsidered, because that's how they are enjoying working with Thermo Fisher, and staffing is what they've used. So I just wanted to cover that.
We will certainly inform our team of your how much you enjoyed it, how well it worked for you, and that's all I can commit to at this point, is to go ahead and let them know, and we'll revisit as needed. So, but we have enjoyed working with you. We have enjoyed it. We do still look forward to serving as many districts across the state as are required and need our assistance.
Wonderful. Thank you for that consideration and relaying that message. I see Carmela Hubler still has her hand raised. I'm going to go ahead and unmute you. I'm not sure if I know we asked the question that you had typed, but maybe you have something else. So go ahead and you can go ahead and share.
Yeah, I'm sorry. That was my question. I think I accidentally clicked that by mistake.
Okay. Wonderful.
Yeah, what I was asking is, does the school need to sign up again to participate? But I think you answered that we won't need to.
No, you can continue. If you have new test administrators, then we would, work with you on that. But in terms of you being signed up already, you're in good shape.
Okay, yeah, we will have one new nurse, so we'll make sure she reaches out to get trained. Thank you.
Wonderful. Thank you. Someone else dropped in the chat. We've been very pleased with Thermo Fisher and color. So thank you. That's what they say. So I wanted to make sure you all got that and heard that shout out.
Yeah. Thank you so much for all the feedback. We really appreciate that.
Got it. I think you guys have kind of addressed this question already. Can you all see the chat, the Q&A feature? Karen and Eve, I'll let you all answer that. I don't know if you want to further reiterate. I mean, I think you've already kind of addressed it, but I'll leave it there for you all.
We will certainly bring your requests for continued staffing report to our team management. At this time, if we're not offering staffing to the entire state, it is unlikely that we would be able to offer staffing to select districts only. But we will certainly share your concerns, how much you enjoyed that feature and how well it worked for you with our team. Thank you very much.
And this is Diane. Just so that everyone is familiar, that if Thermo Fisher decides to make a change to their menu of offerings, DSHS is open to that. There's not a certain time period that Thermo Fisher is restricted to do those offerings. At any time, they can make a change, and DSHS reviews it, and then most of the time accepts their changes. So, if Thermo Fisher decides to offer staff in January, then they would submit the information to DSHS, we would review it and most probably approve it. But at this point, they have chosen to not go down that road.
Great. Thank you for the clarification on that.
So we got about 12 minutes left that was allocated for this webinar. So if there are any more questions, feel free to drop them in the Q&A feature or in the chat while we still have a little bit of time left. And while they're thinking of any last questions, if anyone from Thermo Fisher wanted to say any last points or reiterate anything before we close out today, feel free to do so.
Yeah, just thank you again for having us today. We really look forward to continuing to work with the districts across the state of Texas. It's been a great experience for us as well. So the feelings are definitely mutual. We are, as I mentioned, dedicated to ensuring that we can really maximize in-person learning days, ensuring that we're not having to close classrooms or schools due to outbreaks. Just as an aside, as we close out, across all of our programs throughout the US, we are absolutely seeing the positivity rate continue to increase. for COVID, meaning that as much as we're all done with COVID, it is still here. And this is such an important topic for our schools, from both the administrative side of being able to ensure the health and safety of the staff, and ensuring that they could be adequately prepared to be able to have enough staff available to teach the kids, along with the safety of the children in the classroom. Such an important issue. And thank you so much for allowing us to come here and present our option today.
Got it. Thank you for that, Karen. Eve, I saw you just dropped a message in the chat. Is that in reference to the Q&A question that was presented?
Yes, I was just saying, if you all have any questions or you want to sign up, feel free to email ReadyCheckGo@thermofisher.com. And thank you all again. Really appreciate your time.
We will monitor that email box and make sure that any of your concerns, questions, or requests are adequately transferred to the correct people. Thank you.
Wonderful. Well, thank you. I'm gonna give about 1 more minute for any last questions, and then if not, we will go ahead and conclude this presentation. And thank you so much, Thermo Fisher, for your wonderful presentation and answering all the questions. Thank you all.
Thank you.
Give it a few more seconds, and then we'll conclude. Well, I think that was enough teacher wait time, as we call it. I'm a former teacher. So with that said, thank you all. Thank you to all the attendees. We'll get this posted in the PowerPoint presentation that they had. Thank you all. Have a great rest of your day, and we'll be in touch soon.
Great.
Thank you all so much.
Yep. Bye.
Bye.